Okay, thank you. All right, I'd like to call the Health Services Committee meeting for May the 24th to order. And the first order of business is approval of the April's meeting. Would someone like to make that motion?
I'd be happy to make the motion, Ed. This is Peter.
Thank you, Peter. Second to that. Supervisor Conover. Any additions or corrections to the minutes? All right, all those in favor?
Aye.
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 All right, opposed? Carried. And with that, good morning, Rob. How are you? I'll turn it over to you.
Good morning, thank you. So I didn't have any action items this month, but folks may be aware that May is recognized as Mental Health Awareness Month. So I thought that I would just take a few moments on the agenda just to highlight a few items related to mental health awareness.
Very good.
Thank you. I know that at the April Board of Supervisors meeting, a proclamation was approved that had been issued by Chairwoman Sieber and declaring May 2021 as Mental Health Awareness Month in Warren County. So I wanted to thank the chairwoman for issuing the proclamation. We use that at different events that we go to. We'll display it. We use it with our community services board and some of our public events. In your packet or with the materials were some handouts, and I'm going to try to share my screen. See how I do this. Let me know if my screen share is working.
Yes, we can see.
Working.
Yep.
Very good, thank you. Now I will try to just go through a few slides here. This is a copy of the proclamation that was issued. So again, thank you to the chairwoman for issuing that and to the board for approving that. These are the handouts. These were some fact sheets that are actually put together by the National Alliance for Mental Illness. And the statistics themselves come from the CDC and the National Institute of Mental Health. But one of the things we know about mental illness is really pretty common. We know that 1 in 5 US adults experience mental illness. So about 20% of people will experience a mental illness. 1 in 25 US adults experience what's called serious mental illness. So the distinction really between a mental illness and serious mental illness is really the degree of functional impairment. People that experience significant functional impairment and interference in their life, with their symptoms interfere significantly in their life, then that's considered serious mental illness. 90% of individuals with serious mental illness have a diagnosis of like schizophrenia or bipolar disorder, or a mental illness to the point where it interferes with work, or mental illness with suicidality. About 17% of youth ages 6 to 17 experience a mental health disorder. Part of this slide shows the most common mental illnesses as anxiety disorder and depression. So we see 19% of adults who experience anxiety, 7% depression. PTSD is at 4%, but we know that veterans experience a higher prevalence of PTSD, some estimates as high as 30%. On this handout, we see mental health treatment, therapy, medication, and self-care have made recovery a reality for most people experiencing mental illness. Unfortunately, there's quite a delay, though, sometimes when people have the onset of symptoms to treatment is 11 years. So people We want people to recognize the symptoms and to seek out treatment sooner for better outcomes. So we know that people who receive treatment in a given year, 43% of adults with mental illness, 64% with serious mental illness, and 51% of youth. So having a mental illness can make it challenging to live everyday life and maintain recovery. This slide shows some of the ways that mental illness can impact on lives. People with serious mental illness have an increased risk for chronic disease like diabetes and cancer. On average, people with serious mental illness die 10 to 25 years earlier than the general population. 19% of US adults with mental illness also have a substance use disorder, and rates of cardiometabolic disease are twice as high in adults with serious mental illness. So we know it can have significant impact on health, family and relationships. At least 8.4 million Americans provide care to an adult with an emotional or mental illness, and caregivers spend an average of 32 hours per week providing unpaid care. In the community, this statistic lists 20% of people experiencing homelessness also have a serious mental illness. I've seen some studies estimate as high as 30%. 37% of people incarcerated in state and federal prisons have a diagnosed mental health disorder. 70% of youth in the juvenile justice system. 1 in 8 of all visits to U.S. emergency departments are related to mental health and substance use disorder issues. Depression is the leading cause of disability worldwide, and depression and anxiety disorders cost the global economy $1 trillion each year in lost productivity. A little bit about suicide. Suicide is the second leading cause of death for people ages 10 to 34. The overall suicide rate has increased 31% since 2001. And suicide is the 10th leading cause of death in the US. 46% of people who die by suicide have a diagnosed mental health condition, and 90% of people who die by suicide have experienced symptoms of a mental health condition. 75% of all people who die by suicide are male, so that's our highest risk population, and middle-aged males are the highest risk population. New York has one of the lowest suicide rates actually among the different states, about 8 per 100,000 population. Our particular counties and the North Country counties tend to have a higher suicide rate than some other regions in the state. One local event that brings awareness to mental health issues and suicide prevention is the annual Hike for Hope Cody's Climb, which actually just took place yesterday on Prospect Mountain. They're doing it a little bit different this year. Every year they do host this hike. This year they have two options. You could have hiked in person yesterday up Prospect Mountain, or this year they're also doing a option 2 where you hike on your own at various locations and maybe take a picture or submit something to help support the Capital Region chapter of the American Foundation for Suicide Prevention. So there's information there on this handout regarding their website and how you could register if you wanted to participate or help to make a donation and help support suicide prevention in our counties. Also, in terms of suicide prevention, there's a National Suicide Prevention Lifeline, 1-800-273-TALK. And then there's also a crisis text line at 741-741. So anyone can text, doesn't have to be hello. Sometimes it says home or got 5, but sending a text to 741-741 will connect you with a crisis counselor. I should mention the Suicide Prevention Lifeline also has an option for veterans that's specific for them. So veterans can call that number and they receive a phone tree, an option to select the line for veterans. And then anyone in our counties interested in direction or more information, referral for services, etc., can contact our office at 518-792-7143. And myself or any of our staff here could assist in helping people to make some connection for outreach. For any Warren County employees, we do have an EAP program. And that's a really great place to start if anybody's experiencing any, symptoms where it's starting to impact on work, to reach out to EAP. So those were the slides I had. And
Rob, I'm glad you brought all of this to our attention. The statistics are unbelievable, though, with some of these issues, but I think the information was really terrific. I was glad that we had that presentation. I appreciate you bringing that to our attention. Does anyone on the committee have any comments that they would like to make to Rob or any questions? More?
Thank you. I have a question, about access to the mental health system. It's been my experience through people in my life who have needed to access the system for the first time that it can be challenging to get hooked up with a psychiatrist. And I'm curious as to whether, Rob, you think that is that because of some state policy deficiency? Is it something that is common across the country? From your perspective, I'm curious to know why you think that problem exists and whether there's anything that, from a policy perspective as a local government, we could do to improve it.
Yeah, I think that, well, first of all, in terms of psychiatry, there is a nationwide shortage of psychiatrists, and that certainly has played out locally. We are fortunate on the children and youth side that we do have child psychiatrists with Behavioral Health Services North. That's the agency that recently took over the services from Glens Falls Hospital, the outpatient services. Just in terms of the access, I guess, Behavioral Health Services North is working with us on that issue. They are moving to a model that's called open access, where people can access the services on a walk-in basis, kind of like urgent care. So we're working on a model like that. They do have a plan within the next 3 to 6 months to develop that and to move to that. In terms of other prescribers, there are psychiatric nurse practitioners that can prescribe medications. So they have several of those on staff. So it's a matter of them getting their staffing up. They have a plan to hire a number of new clinicians over that next 3 to 6 months. So that should help. We also have the Caleo Counseling Services in Hudson Falls, and they also see individuals from either county, Warren or Washington. All of our providers see people from either county. So I don't know. I think, Ryan, that's really my thoughts on it. In terms of it being related to any particular state policy, no, not that I know of. I mean, just the fact that we have these services are operated by contract providers, and the sustainability sometimes is an issue. that limits their ability to hire new staff, pay, competitive wages and those types of things. So in that sense, the reimbursement rates, yes, I could say they are somewhat tied to this issue.
Thank you. Thank you. I'm glad, the open access model sounds great.
Yeah, we have been advocating with our providers to move to that open access, and Caleo Counseling currently has some open access on 1 day a week, but we're hoping to expand that. All of these plans were sort of in process when COVID hit, and that did also kind of delay some of it, although our providers have really been able to move to telehealth and telephonic services pretty quickly during COVID, but that still has not helped the access issue to the degree we wanted. I also would offer that anybody who does experience those access issues could reach out to me directly, and I can help see what I can do to help with that.
Very good. Thank you. Anyone else? All right, we have privilege of the floor. Don, do we have anything?
Good morning, Chairwoman Frazier. No public comment at this time.
Thank you very much. Thank you, Rob. That really was a great presentation, and we'll look forward to hearing from you next month.
Thank you.
All right, Dee, are you out there?
Yes, I am.
Okay, then I'm going to turn it over to you.
Good morning.
Morning.
The items that we have on our agenda are what we had discussed last month and the month before regarding the positions in the office. We had a service specialist resign back in March, and I had been asked by the other individuals in the office if we could take a look at the duties and possibly reclassify the position. So we looked at we are looking to delete the service specialist office for the aging position and create a brand new position, a services assistant office for the aging #1, grade 7, salary at $33,600. It has been approved by the union. And basically this person will be doing a little bit lesser of the job duties as what the previous person was doing.
All right, would someone like to bring that to the floor?
I'll be happy to, Edna. This is Peter.
Thank you, Peter. Second to that, Supervisor Conover. Any discussions? All right, then if not, we're going to call a question. All those in favor? Aye.
Aye.
Everybody in favor? Opposed? All right, thank you. I'm taking that, the motion carried. All right, number 2, Dee.
Okay. And then with this, we would also like to, for number 2 and number 3, we would like to delete the supervisor of volunteers, which is a grade 4, and the aging services assistant part-time grade 4 positions, and also create or move them and change them into a services assistant office for the aging #2, grade 7, and a services assistant office for the aging part-time grade 7 position. So basically we're creating 3 new positions and changing the 3 existing positions we had into these 3 new positions. The budget will be completely neutral, so there will be no change in our budget.
Okay, now this one says pending approval of the CSEA. Are you still waiting on that then?
Nope, so it's the 1 new title and it's been approved by the union, but
Okay.
it's 3 new positions.
Okay, very good. Then would someone like to bring that to the floor? Supervisor Conover, seconded by Supervisor McDevitt. Any discussion?
Yes, thank you.
Is that okay, Mr. McDevitt?
Thank you. Thank you. I need all the help I can get.
All right, any discussion, any questions? All right, then we'll call the question. All those in favor? Aye.
Aye.
Opposed? All right, carried. Thank you. All right, number 3, Dee.
Okay, so that was the creating the services assistant part-time position and deleting the aging services assistant part-time position. Again, this one has been approved by the union.
Okay, very good. Then I'd like someone to bring that motion to the floor.
I'll make that motion, Edna. Peter?
Thank you, Mr. McDevitt, seconded by Supervisor Conover. Any discussion on that? All right, we'll vote on it then. All those in favor? Aye.
Aye.
Thank you. Opposed? Thank you. Carried. All right, Dee, go ahead.
Okay, and so again, with all three of those positions, it was basically, we had the one opening, and we decided to restructure the office and create the three new positions, but delete three positions that we had. So two people got an increase, one person got a decrease, but that position was vacant. So just so that that's pretty clear, budget is completely neutral. There's $6.50 is basically added to our budget, but we are okay for this year.
Okay, thank you.
So that on to the discussion items. Last time I had requested to create a meal site manager grade 2 for Cedars and delete the food service manager position. After discussion at the finance committee, we decided to delete that completely and leave it as the food service manager position and to fill it, the position as it was. So I just wanted to make everyone aware of that.
Okay, thank you. I appreciate that. Anything else, Steve?
That's it this month.
All right, a privilege of the floor, Mr. Lehman, do we have anything there?
We have no public comment at this time.
Any committee member have any questions for Dee, or are we good? All right, and if
We're
not,
good.
thank you very much, Dee. We'll be in contact next month then.
Thank you.
Have a nice afternoon.
You as well.
Thank you. All right, Janelle and Tawn, are you out there?
Good morning, everybody. Yes, Ton and I are here.
Okay, good. We're happy to see you.
Hope everybody had a nice weekend.
Yeah.
Moving right along, our first resolution request is to request to fill a full-time registered professional nurse position, number 22, a grade 19. The annual salary is $47,523. This is due to a resignation, and the anticipated vacancy will be June 3rd. The position is revenue generating.
All right, would someone like to bring a motion to the floor then to approve that? Supervisor Conover, seconded by,
I'll second it, Edna. Peter?
thank you, Supervisor McDevitt. Any discussion on that? All right, then we'll vote on. All those in favor? Aye.
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 Opposed? Carried. Thank you. All right, Janelle?
The second resolution request is to amend the contract with Glendale Animal Hospital to reflect a $10 increase in the rabies specimen submission and shipping rates. This is attachment number 2. Public Health has a rabies prevention program requiring submission of specimens for rabies testing when there's suspected or known exposure. If the animal is a stray or a wild animal, the county is responsible for testing. A $10 rate increase is reflective of increased gas prices through the courier. And in 2020, Warren County submitted 33 specimens, of which 21 of those were billed to Warren County.
All right, would someone like to bring that motion to the floor? Supervisor Conover, seconded by
I'll second it, Edna. Peter?
Supervisor McDevitt. Thank you. Any discussion, any questions? Gowan.
Thank you. Is the test taken here and then brought over to Glens Falls Hospital or to Glens Falls Animal Hospital?
This is more specific to like bats and wild animals. We usually either have the complainant send the animal to the animal hospital, or an animal control or sheriff or law enforcement help us get the animal to the animal hospital. They do the preparation and shipping for us.
All right.
And then the specimen goes down to Albany to the Wadsworth lab, and that's where it's actually tested. The testing is free. It's the vet services and the prep and ship that we're looking to increase.
Okay, thank you.
Thank you, Janelle. Any other questions? All right, then we'll vote on it. All those in favor? Aye.
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 Opposed? All right, carried. Thank you. All right, now,
All right, we're gonna move on to resolutions 3 and 4, which are budget related. And I'll turn it over to Ton.
okay,
Okay, attachment number 3 is a grant we got last year towards COVID. It totaled $95,373, and by the time I wanted to roll forward to this year, I thought it was going to be $17,350, but discovered that actually there was more money to roll over. So I need to update that because the actual funds I can roll over were $22,010 for this year. So I'm just adjusting that by the $4,660. I'm putting it into overtime and part-time salaries is where it's related.
all right. Would someone like to bring that motion to the floor? Supervisor Conover, seconded by,
I'll
Super-
second it, Edna.
thank you, Mr. McDevitt. Any questions? All right, then let's vote on that. All those in favor?
Aye.
Aye.
Opposed? All right, carried. Thank you.
Now, attachment number 4 is now a transfer of funds within this program, the same one. Again, moving items, moving expenses for medical supplies and data processing up to the overtime salaries now that I need to pay for those that were put in for this year. So that totals $2,547.
All right, someone like to make that motion to bring it to the floor? Supervisor Conover?
I'll move it, Edna. I'll
Supervisor.
second it.
Got the second. All right, thank you both, gentlemen. Do we have any questions on that one? It's pretty straightforward. All right, let's vote on it then. All those in favor?
Aye.
Aye. Opposed? All right, carried. Thank you. All right, Janelle, I guess it's back to you? Or
Okay,
is it?
we're gonna move to our items for discussion and review. Attachment 5 and 6 are our fiscal documents that Ton will review.
Okay, thank you.
Attachment number 5 are our financials as of May 13th. Again, our revenues and our expenses are reflected accordingly. I do note again below the salary to give you an idea of where our breakouts are. At this point, we're 29.17% of our budget. And last year at this time, we were at 31.18% of our budget. To note, we are down in regular salaries. Again, that's due to positions that right now are open primarily in the home care. We have nursing positions and one position in the WIC program. Our overtime and our part-time are over the budget, or over last year, I'm sorry, basically, obviously due to COVID. So just to bring to your attention, of the part-time salaries, 64% of them are related to the COVID. And of our overtime salaries, 60.5% are related to overtime, or overtime related to COVID too. So that gives you a good idea. Definitely over 50% of what we're over is because of COVID related activity. On attachment number 4 is number 6 is comparison of last year to this year. Again, we talked about salaries, equipment. Last year at this time, we had 2 vehicles purchased. We did just receive 2 vehicles last week, and we are to receive our 3rd vehicle the end of this month is what we're told. So hopefully that'll be this week. So in the next month, we'll see that probably looking almost the same. Contractual services, again, just due to timing of invoices, it's nothing major there. Everyone is back, still doing some Zoom, but there are more and more people being seen, at least in the preschool program, in person. Employee benefits are down again due to the reduction in salary for regular full-time people. And revenues, again, are reflective. We, again, to emphasize, we're not having, at this point, most of our clinics, the only clinics we're primarily doing are COVID clinics. Janelle can talk later, but one thing is we will be doing, we have to, for a grant for the rabies, we do have to show, I believe it is 4 a year. We haven't shown any yet this year, but we will be showing some rabies clinics going down the road. And those clinics, any donations we receive do offset our expenses for the clinic, for our nurses' times that are there and the vets' time that's there. And that's primarily it for our financials.
Very good. Any questions? Mr. Conover, you usually have a question, so I thought maybe,
Yeah, I actually have, it's actually more of a comment than a
Okay.
question. I just want to say to staff at our health department and also to Ryan Moore, both last year, throughout the year, and now so far this year. Tremendous job in managing, not only responding beautifully through the pandemic, but managing your budget, the county budget through that period. I mean, really, the numbers we've been looking at last year and so far this year, given what we went through and what we are going through, are really being well managed. And I don't want to use the word modest, but much smaller than one might have envisioned. So good job. Good job.
we all agree with you 100%, Ron. They do a tremendous job. All right.
Amen.
All right, Janelle?
Great, we're gonna move on to our attachment 7 and 8 with our status of referrals, and I'll let Tom give a brief report on that as well.
Okay.
Attachment 7A, which is our referrals. Again, this is as of March. I just wanted to know that the referrals down below, the visits, even though referrals went down, and a lot of it is because, again, in February, they shut down again with operations, and referrals start picking up again in March. So we'll start to see that increase. But one thing to note down below on the bottom of the page, when you compare the visits, even though you're thinking, well, referrals are down, but visits are up. Well, in talking with Val on lots of this, you'll see most of the visits that you're seeing an increase in is really PT and physical therapy and speech therapy. And one thing to know with the physical therapy, according to Val, we're seeing more joints. We're seeing patients that are weaker because of the pandemic. They haven't gotten out. They're not exercising as much, and so they need help. And they would prefer the home, in the home PT and ST and any kind of, obviously, due to the pandemic, rather than going out into the public. So that's where we're seeing an increase in physical therapy. The speech therapy is the one that's gone the most. We don't have as many visits as the others, obviously, but it is very important. And that's because we now have a speech therapist that we can utilize for the adults. And she was saying we've had more stroke patients, patients with cancer of the mouth that she's needed to see. So she's got quite a load that she's been seeing. So you'll see last year at this time, we only had 4 speech visits, and now we're up to 37. So we are seeing a big change in that too. So you're seeing more visits when it primarily came to a lot of the therapies. And so we just wanted to bring that to your attention. And attachment 7A is, or 7B is also just listing, which we've been asked, we try to give that to you by town. So you can get an idea of the number of patients we're seeing with the home care. And you'll get an idea, there's 205 that we are seeing in all the individual towns that they are.
Thank you.
Great. Also up for discussion, we have our emergency preparedness activities that we provided and our rabies program statistics for you. So if anybody has any questions, we're happy to entertain those.
Anybody have any questions? Okay, thank you. We'll move along then, Janelle.
Okay, we did not have any referral pending items, and moving on to the privilege of the floor with a COVID-19 update. I know Ryan sent out our update. Our numbers for vaccination are looking awesome. Our staff have been working very hard. We've tried to be as versatile as we can. Right now, our focus is businesses and schools. We're trying to get out there to hit the 12 and older population. We had a lot of clinics on Friday, and our staff are working on a lot of clinics today to cover all of our schools. We initially went in and offered clinics for 16 and older, and then we went back, and now we're doing the 12 and olders, which actually has worked out nicely because we're back for the second doses for the 16 and olders while we're offering the first doses for the 12 and olders. So we actually using our resources wisely from that standpoint. We've also asked that any businesses that would like us to come, we're happy to do. We are working with the Sagamore for some of their summer help. We're working with Great Escape. We're happy to work with anybody that reaches out for us. One of the other projects that we have is we're trying to kind of hit nail salons and ethnic food restaurants to see if we can help them vaccinate their staff and their family and friends. So we are running a little campaign where we're doing some on-site visiting and proactively seeking to see if we can help them get vaccinated or see what any needs there are so that we can kind of help address those. On very, very good, exciting news, late last week, I spoke with Supervisor Frazier about an additional agenda item just for discussion at this point, but for our next meeting, hopefully we'll be asking to help enter in the contract. But I received notification that we will be receiving $1.7 million in grant funding to be able to help with school testing. I will have more information coming up at my ISHO meeting tomorrow, and then I have a state meeting on this on Wednesday, and I have to provide interest response by the 3rd of June. And then at that point, then we'll know what our deliverables are going to be specifically for the grant money. My suspicion is that it's all centered around testing in schools, which we kind of already did last November when we set all of our schools up to be able to provide rapid testing. I'm hoping that maybe this grant will go back and cover some of that time. But on a go forward basis, we'll figure out what we have to do. But the actual amount of that is $1,730,012 that we have the opportunity to utilize. So we're excited about learning more about that, and we'll certainly let you know more at our next board meeting, our next committee meeting.
Well, it certainly is exciting news. There's no doubt about that. And we'll look forward to hearing what you have to say next month on that. But thank you, Janelle. Any committee members have any comments? Okay, Janelle, anything else?
That is all I have.
Okay, thank you. We'll go then to privilege of the floor. Mr. Lehman, do we have anything with that exciting news? I'd hope you'd have a comment.
While that is very exciting news, unfortunately, it has not resonated yet with the residents of Warren County, so
I knew you were going to say that, but that's okay.
I'll try.
Okay, with that then, thank you, Janelle. We'll be in touch with what's coming down over the next few weeks. And with that, I'll entertain a motion to adjourn.
Also move, Edna, Peter.
Mr. McDevitt, second by Mr. Conover.
I'll second.
Okay, thank you. All right, all those in favor?
Aye.
Aye.
All right, have a nice afternoon. Thank you all.